Hi, my name's Karen Ward and I'm a diabetes nurse. I'm also a student at the University of South Wales. Today I'm going to talk with somebody who has type 2 diabetes and has reduced her risk of cardiovascular disease. Cardiovascular disease, also known as macrovascular disease, is a disease of the large blood vessels of the body. These blood vessels supply the heart, the brain, the legs and the arms. People with type 2 diabetes are 5 times more at risk of cardiovascular disease, and 50% of people with type 2 diabetes are likely to die from cardiovascular disease. It can also cause chronic health problems. However, cardiovascular disease and its complications are not inevitable. If you have type 2 diabetes, you can reduce your risk of cardiovascular disease and improve your future health. So how does type 2 diabetes cause cardiovascular disease? Poor blood glucose, high cholesterol, high blood pressure, excess weight and lack of exercise all contribute to the build-up of fatty material on the walls of the arteries. This is known as atherosclerosis. The fatty material causes narrowing of the blood vessels and can lead to blocked blood vessels, depriving vital organs of oxygen. The heart is like a pump in a central heating system, and if the pipes in the system are clogged up, the boiler, that's the heart, has to work a lot harder and damage is often caused. Cardiovascular disease can result in heart attacks, strokes or loss of limbs. Women with diabetes are also at risk. In fact, studies show that women may be more at risk than men. People often have no symptoms of cardiovascular disease until damage is done. Medications for diabetes, blood pressure and cholesterol has reduced the impact of cardiovascular disease quite significantly. Studies have shown that lifestyle changes have a big impact on cardiovascular risk. Wendy, hi.
Hi.
When you were diagnosed with type 2 diabetes, how did you feel?
Upset? Or do you mean how did I feel generally in myself?
Yeah, how did you feel in yourself and how did you feel about being diagnosed with diabetes?
I felt, well, I was very tired, I'd lost weight, and I happened to see something on the telly which thought, I do this, I do that. So I went to the doctor, and then when it was confirmed, I was really, really upset because it happens to other people, not to you. That's how I felt. So, you know, I really was upset about it.
And how did you feel that might impact you, you know, your future health?
I didn't really know how it would you know, affect my health, because diabetes, you just think, oh, diabetes, you know, they can have insulin and things like that, but I didn't realise what damage could be done.
And when you first heard about the risks of cardiovascular disease, was that worrying?
It was a shock. Yeah, it was quite worrying. You know, not just the cardiovascular, but other things that can happen, you know, until you're actually told, you don't know. You don't know. And then it does come as a bit of a shock, and it is worrying.
You've made huge changes in your life that's really benefited your health. You've lost a significant amount of weight. Do you feel different now that you've lost all that weight?
It's given me confidence, given me lots more confidence. Obviously my aches and pains aren't as bad as they were. You know, my knees are better. All sorts of things make you feel better when you've lost weight. You know, I don't get embarrassed. I used to get really embarrassed about how big I was.
Right, yeah. And your health was quite poor at one time.
Yes, it was. I had, apart from the diabetes, I had polymyalgia. I've got arthritis as well, but all these seems to have improved with the loss of weight, even though I am still diabetic.
And you've been able to increase the amount of exercise you've done.
Oh, yes.
So tell me what you do now that you didn't used to do.
Well, I went to my diabetic nurse, and she recommended certain things because I was getting depressed about being so big and not being able to do anything. So she recommended the Vitality and the Expert program. But now, now I'm water exercising twice a week, and I go Nordic walking as well. I don't swim so often, but I often go swimming on a Sunday morning as well.
Well, that's great, excellent. And what inspired you to make changes?
I think, well, Deborah, my diabetic nurse, she was the one that said this will help. She seemed to be the only one that listened to me when I said, I can't do this and I can't do that, and she said, well, try this and try that, and she was brilliant. And once I started going and started to feel a bit better, it makes you want to go a lot more. Plus the social aspect as well, I enjoyed that.
So it's made quite a difference to your life.
Oh yes, yes, you know, I'm not so much of a couch potato that I was. And even if you feel I can't be bothered, you think, no, you know, I'll see the girls or I'll see so and so, and I love the water exercises. Walking, the Nordic walking, I enjoy, but I'm not an actual walker. I enjoy the swimming.
That's brilliant, and you've been able to cut your insulin down quite a lot.
Half, well, at least half, yes, an awful lot. Once the weight started coming off, the insulin was then reduced, and it's a lot better.
Brilliant. And you talk about the expert course. That's
Yeah.
a course that we recommend to people.
Yes.
It's a 6-week course.
Yes.
You go for 2.5 hours a week and learn all about diabetes and how best to manage it.
Yes.
A lot of my patients tell me that they haven't really got time because they're working or whatever to be able to go on the course. What would you say to them?
I would say try and get on the course. There are courses all over the place, and if you can get one nearer to you, I don't know whether it's true, but I'm sure that if you've got a medical condition and you're working, perhaps your boss or somebody can give you permission to go for those couple of hours, because it is beneficial, very much so.
You found it really helpful?
Yes, yes.
And it helped you to make and stick at those lifestyle changes?
Well, yes, and also, like again, it's the social aspect, because most of me, they're all in the same boat. We're all diabetics at different degrees, but then that's how I got to know about Nordic walking, because at the end of the course you're shown about Nordic walking.
And you found it helpful to be able to chat with other people
Yeah.
who've also got diabetes,
Yeah.
who know how you feel?
Yes, because one of the main questions is, how long have you had it? You know, how do you feel? Do you feel tired? Do you feel this? And when you talk to the people, perhaps somebody's got a different thing to you, like a different feeling, but most of us feel exactly the same, and it's nice to know that somebody feels the same as you do.
Well, Wendy, you've done incredibly well,
Oh, thank
really,
you.
really well, and your risks of cardiovascular disease have reduced quite significantly.
Yeah.
And I wish you all the best for the future.
Thank you. I intend to live as old as my mum, and she was gone 90, so I've got a long way to go.
If you have type 2 diabetes, talk with your diabetes care provider about a local diabetes course where you can learn how to be in control of your diabetes. Like Wendy, you too can make a difference to your diabetes health and your future health. Further information can be found on the Diabetes UK website.